Hi, I'm Donal, an early career researcher in rare disease, and I'm here with Carla Moran, and she's going to tell us a little bit about her background in clinical research in rare disease.
Thank you, Donal. Lovely to be here today, and nice to talk to you about one of my favourite topics. I'm Carla Moran. I'm a consultant endocrinologist, and I'm an associate professor at UCD School of Medicine. I have a particular interest in thyroid disease, especially rare thyroid disease. So hopefully I can share with you my experience about that today.
Okay. Can you tell me, was there any specific moment in your training where you felt that you wanted to do clinical research, and particularly why did you pursue the area that you've focused on?
Yeah, so maybe I can start by telling you a little bit about how I kind of got into research. So I did most of my medical training in Ireland, and I had done my specialist training here. And then I had to do 1 year of research. And I attended a talk at an SBR study day given by Mark Gurnell, who's a consultant in the UK. And I was really impressed by his talk. He was really enthusiastic about his topic. He was an excellent communicator. And during the talk, he offered for people to come and work with him in Cambridge. And so I thought that this was my opportunity and I was going to seize this. So I was awarded one of the MSD bursaries through RCPI. And that really opened the doors for me because that allowed me to be able to go to Cambridge with that bursary and start to study rare disease. And I have to say, when I went at first, I was quite intimidated because, as you probably know, the University of Cambridge is centuries old. It has over 100 Nobel Prizes, and I thought I'm never going to be able to live up to this. But I was really excited to go, and I was really enthusiastic, and I like change. So it was just a really exciting time for me to be able to go there. And I worked there with a supervisor called Krish Chatterjee. And Prof. Chatterjee had been working for decades on a rare thyroid disease called resistance to thyroid hormone. And he had made some really seminal discoveries in thyroid hormone action. And he worked with me to identify a project, and we started looking at metabolic aspects of resistance to thyroid hormone. So that really was my gateway into rare thyroid disease research, and it kind of whetted my appetite and understanding that area a bit more.
Okay, very interesting. Do you think all trainees should be involved in clinical research? And if anyone was thinking about getting involved, what advice would you have for them?
Yeah, so do I think all trainees should be involved in research? So I feel really strong about this. I think all trainees should. I think that we are never going to be able to make any discoveries in medicine if we don't do research, and it is so important. I think everybody should be involved in research so that they understand how it's done and that they can interpret the medical literature properly and that they can use the discoveries in research for their own patients. And I think even if we don't want to do research ourselves, I think it's important to have done research at some stage so that we can support our colleagues in doing it. So for example, if we work in research active units, even if we're not directly doing the research ourselves, we can support our colleagues by recruiting patients, for instance, or even taking on a small aspect of that research. And so it can work together in a unit for us all to be working collaboratively in doing some level of research, even if we're not running that research ourselves. I think you get skills doing research that you wouldn't obtain any other way. So I think that that's important. And you build up networks with other people, and that can be very rewarding. The second part of your question, I can't remember now.
I was going to say that's reassuring for the start for me.
Yeah.
It was just if you had any advice really for someone who was considering, so
Yes.
you would recommend.
So I would definitely recommend research, highly recommend research. It's really enjoyable. In terms of advising people if they're starting out on a research journey, so I think the first thing to say is not to be daunted by it. If you've never done research before, it can seem very different from your clinical work. But there's lots of different types of research. So there's lab-based research, translational research, clinical research. There's research that's done in a wet lab, but there's also research now that's done analysing large volumes of data. So depending on your skill set and what you enjoy, you might be drawn to different areas of research. So it's important to think about that and think about what you'd like to do, because the first hurdle really is to identify a project that you are going to be interested in. Because as you'll know from doing research, certainly if you're doing a higher degree, you choose an area of research that is going to be your own. and you have ownership of that. So if you're not interested in it, you'll definitely fall, I think, at the first hurdle. The second bit of advice I would give to people is choose a good supervisor. And that can be tricky because you don't really know how to choose a supervisor. You've never done that before. So I think when you go for an interview with a supervisor, you need to understand what they're excited about, what kind of research they do, and have a little look at their track record. So, have they been championing their other researchers? What's their publication record? Speak with the previous trainees or people who've worked with them and see if you think it would be a good fit for you. So that's really important, I think. And then if people are actually starting out on their research journey, so they've chosen their project and they've chosen their supervisor and they're starting off, I would say it's so important to hit the ground running. That's really important. So don't spend the first couple of months, sitting down and having coffee. Get yourself ready. So I would say start writing your introductory chapter if you're doing a higher degree. Think about offering to do a review article. That's a really good way of looking at the literature and summarising and knowing the literature yourself. And then set out goals for yourself. Aim to meet with your supervisor every 3 months. Every 3 months you should be making progress in something. So that's really important. And the other thing I would say is try your best to be visible. And I don't just mean visible in your group, but visible with your collaborators, visible on the national and international stage if you can. So, for example, if you arrange a video call with some potential collaborators, offer to do a couple of introductory slides on your research to introduce them to the research. It gets you used to presenting the topic. It gets you used to being, on the stage and being asked questions. And offer, of course, to present at conferences. So every conference, look out for the year for the conferences, get to know the abstract deadlines and always put something in. And if you go to a conference and, for example, you're presenting a poster, it's really difficult to put yourself forward to present that poster. But if somebody's coming by and has any interest, say to them, can I give you a 1-minute summary of my research? And you'll be amazed at how many connections you can make in that way. And that will open doors for you then, I think, in the long term.
Yeah. Those points are really helpful, and particularly the one, I suppose, about getting into research where it's not all lab-based necessarily, or there's so many avenues into it. And then, like you said, once you get started, I can vouch for myself, you got to try and hit the ground running best you can.
Absolutely, yeah.
What kind of, looking back at your own clinical research career so far, what challenges have you had to overcome? And is there challenges in general, I suppose, and is there any that are unique to the rare disease area?
Yeah. So I think general challenges have stayed the same for me. So one was time, certainly still is, and the other, of course, is funding. The time wasn't so much of an issue when I was doing my fellowship and my PhD because I had dedicated research time. But now in a clinical job, I find it very difficult to carve out academic time. And I think that's something that I would really like to see change over the next however many years or decades, because at the moment there's very few posts in Ireland for clinicians to have dedicated academic time. And we can sometimes apply for funding, but they have to be quite large funding pots to be able to allow us to be freed from our clinical work. So that's a challenge. And trying to apply for those large grants takes a lot of time and a lot of effort. So that's always a challenge. So that's where the small grants are really important, because they can still help you do research, and you can find a different way to fund your trainee or your student. Then that can allow you actually to do quite a lot of research with a smaller amount of money. The other thing that I really welcome in terms of funding is the Consultant Innovation Fund and the Spark Innovation projects that have been launched by the HSE. I'm very excited about those, and I genuinely think they will change lives of patients, actually, and it enables us to do research, so that's really welcome. So time and funding are an issue, I think. And then specifically to rare disease, often the difficulties with regard to rare disease might be recruitment of patients. And there's multiple levels at that. So many patients with rare disease don't even have a diagnosis as yet. So that's a problem. Even if they're given a diagnosis, they might not be referred on to a specialist centre that's doing the research. And then even if they get to the specialist centre, there's hurdles for them to be able to take part in research. So many patients with rare disease might have additional needs, or they're spread geographically far and wide over the island of Ireland. So it can be difficult for them even to access the research. So I think recruitment is a specific challenge for rare disease.
Yeah. And it's really, I suppose, I fully agree with your points on the kind of clinical research side of things, where a lot of us as trainees are getting a year or two involved in it, but it doesn't necessarily mean we'll have a consultant post that can facilitate research. So I'd be of the same opinion of you there, as you there. Just going back to, as an early trainee now, is there any skill that you picked up when you were at my stage that you felt you're still putting into practice today, or still stood you?
Yeah, so I think that one skill, or maybe it's an attribute, but I think people could develop it, is an ability to work independently. So, certainly when I was a young trainee, I would try my best to make a diagnosis, make a management plan, and come to the consultant with that in place. And I think as trainees, that's a really good mindset to have, because if you're of that mindset, when you're interacting with your supervisor, the level of interaction will be at a much higher level. And what your supervisor will be very interested in whatever condition that they're investigating. So they want to have high level discussions about these things. So I think if you can think about the research problem, go about trying to answer the questions and have some idea about how you might answer those questions and ideas about interpretation of the data that you've gathered, that will make your interaction with your supervisor much more fruitful. And overall, it'll really strengthen your research, and it will really improve your feeling of ownership of your research as well.
That's really good advice too. Just, you may have touched on already, but was there something that, again, when you were an early career researcher, you didn't realize was part of the job? Other stakeholders you might have to engage with. Any insight that I just may not know about? I'd be surprised by.
Yeah, so it's surprising, really, the skills that you require. You don't realize you need them. So I think I probably didn't realize how much writing was involved in research. Writing ethics, writing grants, writing your publication, writing abstract. And actually, that's not something I terribly enjoy. So I really had to, I much more enjoy kind of thinking about the research project and then analysing the data. And then it's already all in my head, and then somehow I have to communicate that in written form. Yeah. So there's an awful lot of writing involved. And then, I think as you get more senior, the skills that you require change a little bit. So I think that if people really want to have a dedicated career in research, there are additional skills that we have to have. So we have to be excellent at communicating our research, but not just with their colleagues. We have to be able to communicate with funders. We have to communicate with, obviously, patient groups. We have to communicate with government groups. We have to be an advocate for our patients and lobby on their behalf. And the other things you have to do as a senior researcher that probably you don't have to do as a junior researcher so much is understand the financial aspects of research. So you have to be able to manage a budget very well, plan ahead for the budget. You have to be able to strategize, plan ahead your research. You have to know what other research groups are doing and how your research is going to fit into the worldwide research. So I think the kind of things and the skills you need to hone change a little bit with time. Did I answer your question?
Yeah, no, I'm starting to see that a little bit in the short time I've been in the kind of research.
And you have to be flexible as well.
Yeah.
So for example, I'm in the process of submitting a grant at the moment, which is an international grant, and something that I really hadn't been aware of is intellectual property, legal rights to what's generated from the research. I hadn't really had to deal with that before, but that's something that we've had a lot of discussions about, and with the universities and with our industry partner. So you have to kind of develop these skills as you go along, and you don't envisage that you'll ever have to do that.
Of course. And so to kind of sum things up, what continues to motivate you in your commitment to research in rare disease? And is there any kind of interesting future impact things that you want to mention, or to kind of tie things up?
Yeah. So I think the big motivator for me is really patience. You know, being able to sit with somebody in clinic and, you know, listen to their story and their journey to how they came to you, and to interact with them in a meaningful way, and be able to describe their condition in accessible language, and tell them about the research that you've done in their condition. That's hugely rewarding. And having that interaction with the patient who might have had a long journey to reach you is really enjoyable. And there's hardly a day that goes by that patients don't thank you for what you do. And there's very few jobs really that happens in. So that's great.
Yeah.
The condition that I research is genetic, and it's inherited in an autosomal dominant fashion. So it's often families that I'm dealing with rather than just a single patient. And patients can be hugely motivated, and I'm hugely motivated by the fact that the research that we're doing now will be there for decades, and that research will inform how the research that I'm training later on will look after their children and later on their grandchildren. So that's hugely motivating. And I really enjoy the aspect of rare disease of, you know, being almost uniquely placed, certainly in Ireland, and one of the few people, you know, in Europe that has a really strong in-depth understanding of these particular, you know, conditions that I look after. So that's very motivating. And then the other thing that motivates me really, and that I really enjoy, is developing a network of researchers. So in the group of conditions that I research, there's probably about 100 researchers worldwide that are dedicated to this. And we meet up every 2 years and we share our research. And that's very motivating, because we're all performing research that informs each other's research. And we come up with new ideas and collaborations. And it's a real way to move forward. That kind of collaboration really moves the field forward. Yeah. And then you mentioned about things that are coming down the line. So I think for rare disease, a real challenge, and certainly for the conditions that I look after, is diagnosis. How do we increase the chances that somebody with a rare disease is going to get a diagnosis? So I think there's improved access to genetic testing, which is great. And certainly nowadays we're developing what we would term gene panels, so that if somebody has a particular clinical phenotype, for example, short stature or developmental delay, we can do a gene panel. And one of the things I do is advocate that the conditions that I look after, is the genes relevant to those are on that gene panel. So we'll increase the likelihood that a patient will get a diagnosis. The other study that I'm involved with in the UK is looking at newborn screening, and perhaps using genetics at the time of birth to try and identify these conditions at an earlier stage. So I think we'll move forward in terms of diagnostics from a genetic point of view. The other thing we're trying to move forward in terms of diagnostics is novel ways to diagnose the conditions that I look after. So for example, there's one thyroid condition which causes profound hypothyroidism, but the patient has normal thyroid function tests, which, as you know, is very unusual.
Yes.
And so we're working with other researchers to develop an app where the clinician can take a photograph of the patient, and the app can then tell the clinician whether they might have this particular condition. So it's a novel way to diagnose the condition. And we've looked at things like metabolomics and proteomics, and looking for panels of changes in parameters in the bloodstream that might suggest these rare conditions. So I think there's novel ways to diagnose these conditions. And then the other thing that might help in the future is AI, of course. We have to mention AI. So one of the conditions that I look after, we've just recently discovered, causes early cardiac disease. But when that happens at an early stage, it's very difficult to pick up. We can only really pick it up once it's actually happened. So there might be novel ways of analysing, for example, heart rhythms or cardiac MRIs that could pick up subtle changes in the heart function or rhythm that might inform us that this is the subset of patients that are going to run into trouble from a heart point of view. So I think that's a potential. And then lastly, in terms of therapy, we're looking at repurposing thyroid hormone analogues to treat forms of resistance to thyroid hormone. And there are some research funding opportunities that are specifically targeted towards repurposing drugs or developing small molecules to treat rare diseases. So I think that's all good things on the horizon.
Very interesting.
And I think also the interest in rare disease has really increased, and the networks for patients and for researchers have really improved. So I think that that's all a really good thing. It's really emphasizing that rare diseases are important, that collectively they're not so rare, and that we really need to invest in research and clinical infrastructure for these patients.
Well, it's been so interesting chatting, and just to hear your research journey and the tips and advice you had has been really great for me to hear, and hopefully for our audience as well. And thanks so much for sharing some of the future things that are coming along as well, that there's lots of interesting projects going on. And I know in all the different rare diseases that are being researched here, there's lots of different interesting similar projects going on. So I'd just like to thank you for having the chat with me today, and it's been great learning so much.
You're very welcome. It's been a pleasure. Thank you.
Thank you.